Hello everyone, very good afternoon to one and all. Welcome back to the Vichita Rajkumar online classes. Today I am going to discuss about the practical record in that questions with answers in the section of the 2. Okay, in the subject of the health center management for the MPHW secondary students who were watching first time, please watch till end of my video, like, share, comment and subscribe my channel, and you have to hit the bell icon for more updated information. Okay, let me see the one by one. So in this, like a section 2, 5 questions will be there. In that, 8th question is deleted, so no need of read and write. So let me see the one by one with the questions and answers in briefly. Okay. Okay, this is the first question in section 2. Like a section 2, explain briefly about the role of female health worker in population education and family welfare. Okay, so here the maintain that you have to what we have to do. Population education is nothing but the as a healthcare department people we should as a responsibility how we can control the population. So by following some of the methods, by we have to make the people to adopt some of the following methods like so based on their convenient way, like a different methods will be there, like a primary mothers who are first time pregnant, we can call it as a primary mothers. Okay, primary mother for next delivery they may have the first. Okay, for next delivery they have to maintain the spacing, so that's the reason first primary mothers after the delivery they have to maintain the for next pregnancy they have to maintain the spacing by following the methods like condoms or oral pills or IUD intrauterine devices, copper T, lipus loop T. Okay, so different like injection hormonal methods, mechanical methods, biological methods. Okay, mechanical, physical, biological, natural methods. So the different methods will be there. So based on that, first what we have to do, we have to do the survey. Based on the survey we can came to know that the like how many mothers will be there. Okay, like a EC is nothing but the eligible couples. Okay, so we have to see the eligible couples and we have to focusing on the target couples. Okay, so these are all the things will be there as a healthcare providers. We should control the population by following the methods like temporary methods and permanent methods. So temporary methods is again classified into different ways like natural methods, physical methods, chemical methods, biological methods, mechanical methods and hormonal methods. Okay, in this different again like natural methods are nothing but the lactation laminary method, abstinence, not having any kind of sex. Okay, coitus withdrawal method. Okay, and next basal body temperature. Okay, and safe period. Okay, so those are some of the methods will be there. So without having any kind of sex, by following like the temperature methods, like cervical mucus method, these are all the methods that comes under natural methods. By following, if the educated mother will have the such a knowledge based on when the ovulation period, when she have the safe period. Okay, if she knows easily she can adopt this method to control the population, like to control the next pregnancy under. Okay, it's clear na. So next like condoms, oral pills also different kinds will be there, mala and malady. This is free of supply will be there in government all the hospitals. Okay, next progesterone pills, male pills, once monthly pills, so different pills will be there. Like in this whoever supplying there, the government set up government hospital, this mala and malady, this drugs will be there. In this 28 tablets will be there. In 28 tablets 21 is the hormonal methods, 7 tablets is consisting of the iron pills. Okay, so these all the things will be there. Okay, but you have such knowledge, if you have such knowledge easily can elaborate the role and responsibilities of the female worker in population education family welfare. Okay, so what we have to do, maintain the eligible couple register, utilize the information from the eligible couples and encourage them to follow the one of the following methods. Okay, spread the message of family planning to the couples. Already I have told no, eligible couples and target couples. Eligible couples are nothing but the who are the beneficiary to following these methods and all. Okay, like say 18 to some of the books 15, some of the books are 18. Okay, 18 to 45 years, these age groups we can call it as eligible couples. Okay, motivate them for family planning. Okay, individually and group also. Distribute conventional contraceptive and oral contraceptives. Okay, oral contraceptives are nothing but the oral pills and all. Okay, malay and malady. Okay, it's clear na. So next coming to the provide facilities to family planning acceptors. Okay, who are acceptors, who are accepting availability, acceptability, who are willing to use this one, we can provide all the facilities for the family planning members. It's clear na. Okay, family like eligible couples and all. Identify side effects, give treatment on the spot for side effects and minor complaints. Okay, if the anybody will complain, immediately we have to provide the facilities for the like a treatment. Okay, It's clear, we have to identify the side effects, we have to give the prompt treatment on the spot. So don't delay and all. Okay. Next, refer the case who requires medical services. Establish female depot holders. Okay. So next, coming to the provide a continuous supply of conventional contraceptives to the depot holders. Okay, build rapport with acceptors, village leaders, health guides, the IEs and other, and utilize them for promoting welfare, family welfare program. Okay, identify women leaders and utilize them for spreading the message of family welfare. And you have to participate in this different programs also. Okay, like a participate in some of the health programs related to the population education and family welfare. So nowadays here, like in before days, like a before 1 year and all. So mostly they are doing the family planning method, family how they can control the family planning means like a some I till now I told no like a temporary. In permanent also like a tubectomy vasectomy will be the tubectomy for the females, vasectomy for the males. Okay, nowadays most of the government is taking initiating to controlling the population by following the surgery for the males is the vasectomy. Okay, non-scalpel vasectomy, not vasectomy. It is known as a NSV, non-scalpel NSV. NSV is nothing. The non-scalpel vasectomy. You see, say within of the like a half an hour, it may take to finishing up this surgery like a this one doll. Non-scalpel vasectomy for the males to control the population in permanent way. It's clear now. So in that, some of the camps they are conducting health programs in urban centers, like in community health centers, government hospitals. They are conducting some of the programs, health camps for the people, like especially for the males who are willing to undergo for the permanent family planning methods like a vasectomy, non-scalpel vasectomy, and all. So as a we have to healthcare providers, healthcare workers, you should encourage the people. You have to motivate the people to participate in the some of the health camps for the non-scalpel vasectomy and all. Okay, provide basic health care to mothers and child, motivation and education about the family planning, maintenance of the eligible register. Okay, supplying of the conventional contraceptive, provide services like in-session and follow-up services and spacing methods, motivate and bring the couple for permanent family planning. Okay, so next coming to the provide, sorry, okay, provide post sterilization services. Okay, next, prior education about the side effects of different methods also. Okay, you have to tell about the no need of worry. Okay, a little bit side effects will be there, so no need of worry. Again, if you have still, you can come and consult. So we can provide the treatment for the spot. Okay, that assurance you have to give to the family members. Okay, maintenance of the all types of family planning registers, oral pill register, IUD register, tubectomy register, and etc. and all. Follow up of contraceptive users. Okay, the objective of the follow up is that to provide motivation and emotional support to confirm the presence of the IUD. Okay, follow up is nothing but the already you have done the you have provided services. Again we have to make the people to again we have to come back for any inquiry, for any other related problems and all. We have to confirm whether the, for example, you are the patient, sorry, the mother undergone for the IUD, intrauterine devices property and all. When she will come for the follow-up services, you have to confirm whether the IUD will be present or not. We have to check it, provide motivation, you have to emotional support also. Okay, diagnose and treat side effects. Okay, follow-up instructions, need to check the thread of IUD. We have to check the IUD intrauterine devices like a copper T, lipus loop T, and will be there. No, why we are calling us this IU copper T and all? These are made up of with copper. The shape will be T shape. That is the reason we are calling it the copper T and all. Okay, it's clear now. Visit the clinic wherever the experience side effects of the like fever, pain, and bleeding will be there. No, we have to ask the mother to come for the visit or follow up. Okay, next, if she missed a period, that is also we have to ask for the all the instructions related to that. So if when she under these are all the instructions. Okay, like a when we have to follow the based on the instructions, we have to need to check the thread of IUD, visit the whenever she may have the experience of the and side effects of the like fever, pain, bleeding, if she missed a period. So these are all the instructions you may be asked to mother, and you have to inquiry, you may identify. Okay, based on that you have to do the follow for the regular intervals of the mother. It's clear now. So this is the some of the instructions, some of the important points in this way. So before going to that, what we have to do, at least we have to better to draw the methods. if you know the method easily, you can able to encourage, able to motivate, able to give the instructions to the eligible couples. Based on the instructions, you can make them to adopt according their convenient method. By following these methods easily, we can control the population. Okay, easily we can give the health education to control the population. Okay, to save the family welfare. It's clear. Okay, so now I finished the first question under section 2. So next we are moving on to the section 2 in the second question. Okay. Okay, next question is the explain briefly about 104 and 108 ambulance services. Okay, this is all called as a 104 and 108. These two are comes under ambulance services. Okay, let me see the seventh question under the section 2, the subject of the health center management. See here 108 emergency service. Okay, you can write here. Wait. Okay, so when an emergency is reported through 108, the call taker gathers needed basic information and dispatches appropriate services. Basic information obtained includes here whether the call is placed from a district, a taluk, city, or own, or a exact location or landmark. Okay? The type of what type of emergency, the number of people injured, how many number of people are injured, and the condition of the injured, the caller's name and contact number for location guidance of request. These are all the information they will get the who will get the information like a 108 ambulance services of the people. Okay, next one is the emergency helps dispatch through this experience is extended to reach the site of the emergency in an average of 18 minutes. So how they will get the it will expected to reach the size of the site of the okay expected to reach the site of the emergency in average of 18 minutes. They will take the information. Okay, so pre-hospital care will be given to patients being transported to the nearest hospital. The services is normally free to patients. Thus this you have to write. Okay, if you want you can write it. This is also no problem here. Actually here, see here, emergency help dispatched through this process is expected to reach average 18 minutes. Pre-hospital services, the second point is that pre-hospital services will be in to patients being transported to the nearest hospital. That is the second. Third one is the services is normally free to patients. Okay, 108 is managed by the EMRI. EMRI is nothing but the Emergency Management and Research Institute across more than 10 states in our India. Say if you will observe the ambulance, back of the ambulance or side by side ambulance also, you may you may see like a EMRI. EMRI is nothing but the Emergency Management and Research Institute. If you didn't observe, now you are try to observe the EMRI is there, not you have to check it on the 108 ambulance. Okay, so during an emergency situation, knowing that what to do, what to do, what to do might save someone's life. Okay, here are a few tips on what you should tell the emergency dispatcher while calling for an ambulance. So these are all the points you have to keep in. Be calm and tell the emergency operator the deals about the type of emergency. You will be asked to tell him or the address to whether the ambulance should be reached, including postal code. Okay, your phone number may also be asked for in case the operator needs to contact you for directions and all. If you want you can write these points, otherwise you have to leave in, but the main points is what you have to write here. Okay, the first points you have to write this one. Okay, first points you have to write this one, second one is this one. Okay, third one what you have to write. So here third point is that you have to write this one. Okay, when an emergency is reported through 108, these points also necessary. So if you make a call to, okay, these points you can write like a where the call is placed from, whether it is came from the district, taluk and all, type of emergency, number of people, contact number, everything they may take. Okay, that is the reason you can point it. So next coming to the, so here, so what do you mean by ambulance? What do you mean by ambulance? Especially equipped and ergonomically designed vehicle for transportation. It's a especially equipped and ergonomically, whether it is fit for transportation. Ergonomic is nothing but that it's a maybe fit for the transportation of the patients or not. Okay, that is especially equipped and ergonomically designed vehicle for transportation, emergent treatment of sick or injured people, and capable of providing out of hospital medical care during transit and when stationary. Okay, the term ambulance comes from the Latin word ambulare, as meaning to walk or move about, which is reference to nearly medical care where patients were moved lifting or wheeling. There are so many modes of ambulance: road going ambulance, air going ambulance, water going ambulance. Okay, vans, motorcycle, bicycles, buses, helicopters, aircraft, boat, and hospital. So we know very well about the only hospital, like ambulances and nothing, but the only it will go on the road. That only we know. But so different types of ambulances also available. Air going is, and maybe if the any emergency will be come no, in a, like a in airway. So like a type of air going ambulance. Water means like a boat, a ship, and all who will travel on the water. So they may have the facilities like this and water. Okay. So ambulance is the word come from the Latin word. The meaning is ambulate. The meaning is to walk or move about. So okay, national road safety covers this all the points you have to keep in. That's all no need, ma. Okay, the national ambulance code. Okay, road vehicles and okay, tractors and machineries, agriculture and forestry, determination of burning behavior of interior materials. If you want, you can write. Otherwise, actually, okay, in this you can point these points. Ma, no need to other write. Okay, okay, up to here only you can write it. Okay, so starting only you have to write the introduction and all. I forgot to erase this one. Okay, meaning of like a definition or meaning of ambulance. Okay, can write it. Me okay, these points no need to write. Okay, so next coming to the we will see moving on to the see here. Okay, so this is the ambulance in like introduction. A ambulance already have given a meaning, no. An ambulance is a vehicle for transportation of sick or injured people to from or between places of treatment for an illness or injury, and in some instances will also provide out of hospital medical care to the patients. The word is often associated with the road going emergency ambulances, which from part of an emergency medical service administering emergency care to those with acute medical problem. Acute is nothing but on the spot. Within a short period, if some patients may have the problem, it is called as a acute. Chronic is the for it may take it's not short. Chronic means like it's it take lengthy time and all. Okay, the term ambulance does not have extend the wide range of vehicles other than those flashing warning lights and sirens will be there, no? Okay, this also everything you have tried here. The term ambulance does however extend a wider range of vehicles other than those with flashing warning lights, and it will come, no? The flashing warning lights will be we will observe, we will heard sirens also. The term also includes a large number of non-urgent ambulances which are for transport of patients with an urgent acute kind. That is the reason if the any full rush will be there, if the traffic will be there, no, if the by hearing these sounds, warning lights and sirens, so they may give the space for those people. Okay. Already I have given the term ambulance comes from the Latin word ambulance. Exactly, you can write these points and all. Okay. It's clear, no? Okay, start. Next one is the types of ambulances. Ambulances can be grouped into a depending on whether or not they transport patients and under what conditions. Okay, emergency ambulance, patient transport ambulance, response unit. Okay, bariatric ambulance. Okay, emergency means here provide care to patients with an acute illness. Within short, if they ill, okay, we can write. Okay, provide care to patients with an acute illness or injury. This can be road going vans, boat, helicopters, fixed wing aircraft known as air ambulances. So till now I have we have studied, no, like air, water, road and all. Patient transport here, a vehicle which has the job of transporting patients to from or between places of medical treatment such as hospital, dialysis center and non-urgent care. These can be vans, buses or other vehicles. Okay, patient transport not in that much emergency, that is known as the okay, okay, acute illness. This is a emergency. Patient transport is non-urgent cases. It's this points we can write. Train response unit, it is also known as fly car, a quick response vehicle, which is a vehicle which is used to reach an acutely ill patient quickly and provide on sense care. Since we have to see the urgency of the care, based on that we have to provide the response unit. Okay, acutely ill patient quickly without delaying and all. Okay, next bariatric, here a special type of patient transport ambulance is designed for extremely obese patients equipped with the appropriate tools to move and manage these patients. It's clear na? Okay, this round. Okay, what I am telling bariatric is nothing but the design. This ambulance is mainly designed to extremely obese patients. It's clear? Okay, these are all the types of ambulances and all. Okay, next coming to the equipment. What type of equipment we need? Okay, next coming to the equipment. Okay, in equipment, what type of equipment are needed, are required in ambulance services? Okay, so here the two types, these are the following types of the equipment are needed. Okay, so here equipment directly used for the treatment of patients. Ambulances may be fitted with a range of additional equipment which is used in order to facilitate patient care. Okay, so this points you can write it. Okay, this is mainly equipment directly used for the treatment of patients. Ambulance may be fitted with a range of additional equipment. It's clear na? So two-way radio, trauma lighting or air conditioner. So two-way radio, one of the most important pieces of the equipment, in modern emergency medical services, as it allows for the issuing of jobs to the ambulance and can allow the crew to pass information back to control or to the hospital. Two-way radio. Okay, here issuing of jobs to the ambulance. Okay, so it allows for the issuing of jobs to the ambulance. That is a one, and one more, and it can also allow the crew to pass information back to control or to the hospital. There are two ways will be there. That is the reason the two-way equipment will be there. Next coming to trauma lighting. In additional to a normal working lighting, ambulances can be fitted with a special lighting. Okay. Uh, okay, special lighting will be there. That is the reason ambulances are differently. The flashers will be the different. We can hear the different sound also. Okay. Next, coming to air conditioning. Ambulances are often fitted with a separate air conditioning system to serve the working area from that which serves the cab. Okay, this helps to maintain appropriate temperature for any patients being treated, but may also feature additional features such as filtering against airborne pathogens. Okay, this is the three types of different equipments. The ambulances may be fitted with a range of additional equipment. It's clear now? Okay, these points we can write as this, you can write it now. Okay, it's clear. Start, otherwise you can write the starting point in okay, introduction and all types of ambulances. Okay, equipment and all you can write it. Okay, so next, seer and other ones are data recorders. These are often placed in ambulances to record such information as speed, like a braking power and time, activation of active emergency warnings such as lights, sirens, and as well as seat belt usage. So data recorders also available. So it's the two-way will be there. Okay, so we have seen what two-way. Next, two-way radio. Okay, trauma lighting or air conditioning. And next one is the here. Okay, data recorders also will be there. So he's the it will speed up the information, breaking power, time. Okay, within the average 15 minutes it will take to reach the information from the patients to the ambulance service members. Okay, activation of active emergency warnings such as lights, screens, and as well as seat belt usage. Okay, next one is the active visual warnings also will be there. Okay, the active visual warnings are usually in the form of flashing lights. These flash in order to attract the attention of other road users as the ambulance approaches. To provide warning to motorists approaching a stopped ambulance in dangerous position on the road. Common colors of the ambulance warning. Okay, beacons are blue, red, amber, and white, and clear. It's clear now. So these are all active visual warnings. Next, audible warnings. Ambulances can be fitted with audible warnings, sometimes known as sirens, which can alert people and vehicles to presence of ambulance before they can be seen. Okay, this is all the audio. So here we can observe, but this can be we can heard. It can be audible. Okay. Next, service providers. Okay, here the service providers are mainly government ambulance services operating separately from the although alongside the fire and police service of the area. These ambulances are funded by local and national government. Okay, sorry, who are providing services? Service providers. Okay, government also providing services to the people. Okay, voluntary ambulance service to the charities and non profit companies operate ambulances both in emergency and patient transport system. Not actually everybody knows the only government people only, government hospitals only providing the ambulances. Not only like that, voluntary ambulance services also offering the like a Muslim, like a Christian charity hospitals, like a non-governmental organizations, Lions Club or Rotary Club, some of the voluntary without expecting anything from the people, so they will freely they provide the services like a charities, non-profit companies and all. Okay, private ambulances, private hospitals, so they provide the they may also provide the services for the people. Okay, normal commercial companies with the paid employees but often contact to the local national government. Private companies may provide only the patient transport elements of ambulance care. Charity hospitals, charity ambulance. Okay, okay, next one, the charity ambulance. Okay, charity ambulance. This special type of ambulance is provided by a charity for the purpose of taking sick children or adults on other hospital. Charity hospital. It's clear, na? Provided by a charity for the purpose of taking sick children or adults on other hospitals. These are the services who are providing services in different categories of the people, like government, private, and charity and voluntary. It's clear. Okay, next cardiac ambulance also will be there. If you see this one. Okay, cardiac ambulance. Cardiac ambulance provides a network of fully equipped life support ambulances in the city of Mumbai in case of medical emergency, and a Mumbai resident may across a fairly equipped advanced life support ambulance within the shortest possible time. Ambulances are located in strategic locations. After receiving the call in the shortest possible time, the nearest free ambulance will reach at your place to rescue. Rescue is nothing but the search and save the patient and victim. Whoever injured, we can call as a victim. Cardiac ambulances are equipped with the international quality instruments for international standards of service and care. The emergency physician board are trained, usually working in the city ICU intensive care units and emergency department, and are adequately experienced to handle all the kinds of emergency. So, cardiac ambulance contains doctor, e- uh, elec- uh, electrocardiogram, defibrillator, suction machine, oxygen resuscitation kit, syringe pump, pacemaker, trained nurse, cardiac monitor, portable ventilator, pulse oximeter, emergency medicines, nebulizer, okay, BiPAP, spine board. Okay, these are all the equipments are needed in the cardiac ambulance also. Okay, starting I have told this one only. Okay, this also 108. Okay, you can write. Okay, this points up to here only these 3 points you can write it, ma. Okay, this points, this and this also. Okay, you can write it. If you want, you can write, otherwise no, this no need. This also no need. This is a drafting of kit box will be there in the ambulance. If you want, you can write it, you can draw it. Okay, next one is the 104 services. What type of services providing by dialing the 104? By dialing 104 call center, any person can receive medical information advice from qualified trained paramedics. They utilize medically validated algorithms and assist doctors to drive his forward. Okay, HRMI has customized its platform by developing algorithms suitable to meet the needs of the government. Okay, these are all the things no need of write actually. Okay, but so this only one point you can write it, ma. Okay, so here main point is the this one you can write it. Okay, any person can receive medical information advice from qualified trained paramedics, utilize medically validated algorithm, you can write it. And one more point also you can write it here. This one is the helps to reduce the death rate, infant mortality rate. This points you can write it. Okay, I will tell you these points you can write, and this one is no need. These points, the main aims to reduce death rate, infant mortality rate, maternal mortality rate, and disease morbidity through the medical triage. Triage is nothing but the according to tagging of the people. according to their condition of the patients, we have tagged the people, okay, with the color red, green, yellow, and all. This is the, okay, identification and tagging of the clients, okay, with the help of a call centers and all. Okay, this is the 104 services. Okay. Okay, this points also you can write it. 108 emergency telephone number. Okay, when okay, 108 usually pronounced 108 is a free telephone number for emergency services to call in the Indian states of Andhra Pradesh, Gujarat, Uttarakhand, Goa, Rajasthan, Tamil Nadu, okay, Chhattisgarh, Karnataka, Kerala, Assam, Meghalaya, Himachal Pradesh, and Madhya Pradesh. And so in Andhra Pradesh, sorry, in Telangana also. Okay, that is, it's not right means you have tried this. Okay, when emergency 108 emergency response service is a free 24 by 7 emergency service for providing integrated medical, police and fire emergency services. The service is provided in public private partnership between state government and GVK, okay, Emergency Management and Research Institute. Okay, so the process is, see, the already I have told, no, like starting only I have given, uh, so in average 18 minutes they will take the time to give the proper treatment for the patient's type of emergency and everything you can write. So these are all the things you can write. Okay. Okay, GVK. Okay, so you can write this one and all. Okay, no need to write everything, but you have to write these points and all. This is a very very important points, you can write it. It's clear, these are all important only. Already we have mentioned this one, no need to write this one. Okay. So next, 108 emergency response service is a free service, free emergency service providing integrated medical, police and fire emergency services. This system was introduced nationwide by former Union Health Minister Dr. uh, Anu Anbu Anbumani Ramadas. Okay, it's clear now. Next one is a role of 104 and 108 services to handle medical and police fire emergencies through 108 emergency services. This is a free service delivered through state of art emergency call response centers, and it has over 785 ambulances around Andhra Pradesh, Gujarat, and Uttarakhand. And you can write it Telangana also. Okay, Telangana. It's clear now. Okay, you can write here Telangana also. Don't forget to write. Okay, Telangana. It's clear now. Okay. Okay, now I am going to end up this the seventh question under section 2 in the subject of the health center management. It's clear. So what I am providing in orderly you have to write. Okay, next eighth question is deleted. Next ninth question is explain about organization and functions of the subcenter. Okay, subcenter is the most peripheral and first contact point between the primary health care system and the community. 5,000 population in plain areas and for every 3,000 population in hilly and tribal, desert and backward areas. Okay. Next, objectives of Indian public health standards for subcenters: basic primary health care to the community, achieve and maintain acceptable standard of quality of care, make the services more responsive and services to the needs of the community. Next, here the services to be provided in a subcenter. Maternal and child health. In the maternal MCH, we can also call it as MCH. Antenatal care, antenatal stuff during pregnancy, internatal during labor, post and after the delivery. Okay, child health, family planning and contraception. Okay, counseling and appropriate referral for safe abortion services. Next, adolescent health care, assistance to school health services, control of local endemic diseases such as endemic stress, nothing but a non-stop problem will be there in the particular place. Like in Nalgonda district is a very famous for the fluorosis. It is called as endemic, non-stop continuous problem will be there. Okay, malaria, kalahasa, Japanese encephalitis, filaria, dengue, etc. and control of epidemics. Epidemics is nothing but sudden outbreaks of the diseases. So like a malaria, sudden outbreak it will come in some of the particular places. It's clear, na? Disease surveillance. Okay, and next come the water control monitoring, promotion of sanitation, including use of toilets and appropriate garbage disposable, field visits, community need assessments, curative services, training, coordination, and monitoring. Okay, next one is the 15th point is the national health programs, like national AIDS control program, national vector-borne disease control program. Okay, by the bite of the mosquitoes, it is known as the vectors like a house flies. Okay, okay, different will be there. Na? So many vectors will be there. In that, mosquitoes say very problematic problem like a dengue, chikungunya, malaria, filaria. This is all. Okay. National Leprosy Eradication Program, Integrated Disease Surveillance Projects Program, and next comes the record of vital events, and 16th one is the record maintenance and reporting. Okay, and one more is the how many members are working in the subcenter level. Currently, subcenters are staffed by one female health worker, commonly known as auxiliary nurse midwife, and one male health worker, commonly known as multipurpose health worker male. The support of ASHA, the general norm is one ASHA, but she has to cover the 1,000 population. Okay, physical infrastructure should have its own building. It's a central location with easy access to the population. Okay, always the subcenter, this building is centrally location with easy access to all the population. Next, the pattern of assistance. There was 7,000 rupees assistance to the expectant mothers, pregnant mothers, 600 rupees for ASHA, accredited social health activist, other equivalent worker after institutional delivery in rural area. Okay, 600 assistance to the expectant mothers, 200 rupees for ASHA in urban area. In it, it is duty of ANM, ASHA, Anganwadi worker to make payment to expected mother. But nowadays it's not available. Uh, but they're not getting any separately fixed amount will be there. In Telangana, fixed amount will be there for the ASHA workers, Anganwadi teachers, and all. So before that, there is no fixed amount for the ASHA. That is the reason they may get the holisms by motivating, by for encouraging a safe delivery. If the mother will take the 2 doses of TT, one consultation by the doctor. For that, so the ASHA worker she may get the holisms instead of getting the fixed salary. Okay, but in Telangana region, ASHA workers they are getting fixed in. That is the reason they may not getting in the form of like these honorisms and all. Okay, in the public sector, the health subcenter is the most peripheral and first point of contact between the primary health care system and the community. A subcenter provides interface with the community at the grassroots level, providing all the primary healthcare services. These points you can write it starting. Okay, this is the introduction. Actually, starting you can write it for this one. Okay, next one is the okay. So here the okay. See here, subcenter action plan is a very important tool of work get first. So not or how we so still now I have discussed the introduction, staffing, and functions of the subcenter. But now I'm going to discuss about this is organize when you are organizing the subcenter. What are the plans you plan should be there in your mind. Okay, this is the organization. So this what we have this organization of a subcenter organization heading you have to write like this. Okay, subcenter action plan is a very important tool for work at subcenter. Provides information about activities planned for each village under sub health center. Okay, estimation of all services provided by the subcenter in a particular period. Subcenter action plan is defined as a written document which contains information about the activities to be performed in a specified time frame, indicating resources, timetable, venue, where, when we are conducting each thing. We have to documented in the paper. Okay, for each action to be performed. Next, preparation of the map. First step is to prepare a map of the area covered by the subcenter. It should include all villages, approach roads, important places such as schools, community centers, government offices, and places of worships. Okay. Next one is the survey of the area. Okay, carry out a detailed survey of each village in your area to collect relevant information, conducting meetings, okay, health team recording action plan and include suggestions of team. Identify high risk groups. Identification of high risk groups, it will help in getting setting priorities of the services. That is the reason we have to identify the high risk groups. Okay, okay, next one, filling of action plan form. Based on data collection of form, one is filled which includes following information. So these are all the points. So how to organize the action subcenter means first we have to do what we have to do. Okay, first action plan should be there. Action plan is a very very important tool for the to work at subcenter. Okay, subcenter action plan is defined. So where we have so we have to plan in a paper. Okay, we have to preparation of the plan map is important. Survey, identify high risk cases, filling of action plan. Okay, it's clear. So after filling up of a form one for the year, you may prepare a plan for weekly action plan and monthly action plan and yearly action plan in one page of the form. Okay, na? It's clear. Okay, like a weekly plan, monthly plan, and action plan also you should be clear. Okay, this is like a subcenter action plan to collect the okay community based rehabilitation form. Okay, CD1M, like a medical officers and all. Okay, medical officers office to survey the population of the area, estimate the number of eligible beneficiaries, estimate the number of infants, estimate the number of labours, estimate the number of under 5 children's, estimate the number of antenatal registration, estimate the number of high risk pregnancies, estimate the number of anemic pregnant women, estimate the number of high risk newborns, estimate the number of below 3 years children's. Okay, what district plan is sort out to have a background. So when you like a so when you're having a plan, what you have to do, you have to see the background planning process, priorities as per the background and the planning process, annual plan for each of the health institutions, community action plan, financing of healthcare, management structure to deliver the program, partnerships for convergent action. So if the government, he cannot do the services, with the help of the private also he can provide the better services to the most of the population. That's the reason the government also needs a partnership of the public areas. Okay, so next, accessibility indicators, like number of eligible couples registered in number of annual case sessions held as planned, percentage of subcenters with no NM, number of NM, sorry, percentage subcenters with working equipment of antenatal care, percentage of ANM and trained birth attendants without requisite skill, subcenters with DD, like a delivery, disposable delivery kits. Okay, and percentage of the subcenters with infant weighing machine, percentage of subcenters with a vaccine supply, percentage of substances with ORS, oral rehydration solution, percentage of substances with family planning supplies. These all things will be there. So based on that, we can, if you have such a information with your hand, easily you can organize, easily you can provide services to the population, services to the population. It's clear, na? Okay, just all the things. So till now I discussed about the functions and organization. So when you're organizing, what are the principles we have to follow, what are the instructions we have to follow, everything I have given. And one more I want to give the like a okay, okay, I will give the how to organize the subcenter. Like I will give the simple, okay, simple way. Okay, like this one all. Okay, organization and all. Okay, step by step we have to organize like a cycle. You will see like this na. So first this is the entry, OP. Okay, this is OP. Next one is a physical setup. In physical setup install like a height, weight, BP checking and all. This all comes under physical examination. All okay, height, weight, BP checking and TPR checking. Okay, it's clear. Next one is a checking doctor consultation or not, may not be available, but any problem checking. Okay, here also consultation of these experienced staff, like a male health worker, female health worker will be there, no? Okay, next one is the like a pharmacy distribution of tablets. So tablets, okay, pharmacy tablets and or like a minor pharmacy is nothing but the like a minor elements like a fever, cold, cough, distribution of tablets will be there. Like family plan services will be there, oral pills, condoms supplying. Okay, it's clear na. And any TT, okay, TT injections and all, iron and folic acid tablet supplementations and all. Okay, and next one is the okay, health education and all, and exit. So this, in this way they have, we have to organize the subcenter. It's clear now, organization subcenter like this. Okay, it's clear. So once again I would like to draw. Okay, entry. Okay, next OP. Okay, okay, physical examination, height, weight checking, BP. Okay, BP checking. Next TPR if it's fever. Okay, like an examination, consultation. Okay, next one is the distribution of tablets like a fever, cold, cough. Okay, next distribution of oral pills, condoms, mala and malady. Next distribution of IFA and folic acid tablets and administering the TT vaccine. Okay, and health education. So this and exit. So this is the way we have to organize the. It's clear now. So this is, so till now I have concluded about the ninth question. It's clear. So next I am going to discuss about the last, that is the Arogyasri services. It's clear? Next question is explain detail about the Arogyasri services. This is the last question in section 2 in health center management. Okay, next question is the Arogyasri services. Arogyasri scheme is a flagship scheme of all health institutes introduced in April 2007 by Dr. Y.S.R. Rajshekar Reddy government before bifurcating the Telangana from the Andhra Pradesh and all. Okay, 2007. While he was the chief minister of Andhra Pradesh state with a mission to provide quality health care for the poor, the aim of the government is to achieve health for all. Okay, so here the is one of the flagship scheme of all health initiatives introduced in 2007 in the month of April, okay, by Dr. Y.S.R. Rajshekar Reddy government. Okay, next coming the second one is the mission is to provide quality health care for the people, poor people. Next third one is the main aim of the government is to achieve health for all. Okay, so here also serious diseases affecting heart, kidney, cancer, brain, burns and accident cases etc and all are covered under the scheme. Okay, only these cases only covered under this scheme. A total of 2434 surgeries therapies in 30 systems are covered under the Dr. YSR Arogyasri scheme. Okay, the applicant must have municipal property tax paying families for less than 3000 square feet, 334 square feet ads. Outsourcing contract part-time employees and sanitation workers with annual income of over 5 lakhs are eligible to apply for this Arogyasri scheme. Okay, Arogyasri Health Care Trust by the Government of Telangana. The state government of Telangana then introduced a health insurance scheme named Arogyasri Community Health Insurance Scheme that provides health insurance coverage to below poverty line BPL families. You got it? Again, is the state of Telangana, the state of government of Telangana introduced a health insurance scheme named Arogyasri Community Health Insurance Scheme. It will provide health insurance coverage to below poverty line families. So documents who are eligible to get the services. So some of the documents are required to get the benefits by following this scheme. Aadhaar card, BPL certificate, income certificate and resident proof. Next, YSR Arogyasri Health Card status. Step 1. If you want to know the status by following this step, you can get into your status. Visit the official site, click on the EHS Employees Health Services Scheme. Next, after login, click on Health Card status, enter the required details asked in the portal, click on search and you can see the status of the health card. Okay, next here the Arogyasri card. Rajiv Arogyasri is the flagship scheme of all health initiatives of the state government. Aim is to achieve health for all. The scheme is to assist poor families from catastrophic health expenditure. The scheme is unique public private partnership model in the field of health insurance. It provides end to end cashless services for identified diseases introduced 1st April 2004 in 3 backward in districts of Mahabubnagar, Anantapur and Srikakulam. Okay, free screening or outpatient consultation. The scheme was formulated in the field of medicine, health and insurance. Function through ICT website and all. Okay, so this is the below poverty line. Okay, cell assess 12 percentage, current income 6 point, other 6.10, saving 12. This is all. Okay, so main features if you see like this: universal coverage, cashless treatment, health workers, health camps, simple procedure, caste, diseases, packages, choice of hospital. So these are all things no need to write. This for idea purpose I have given this one. Okay, expansion of this scheme. Okay, you can write this one ma. Okay, expansion of the how the services are spreading all over the India. You see this one expansion is nothing but the spreading the services to all over the phase 1 Mahabub Nagar, Anantapur, Srikakulam, phase 2 Rangareddy, Nalgonda, Chittur, West Godavari. First the phase 1 it was introduced only following the districts only. See. Next phase 2 Rangareddy, Nalgonda, Chittur, West Godavari, East Godavari. Next phase 3 Medak, Karimnagar, Prakasham, YSR, Nellore. Next phase 4 Adilabad, Kurnool, Hyderabad, Visakhapatnam, Vijayanagara. Next phase 5th Nizamabad, Warangal, Khammam, Guntur and Krishna. It's clear. This also you have to write it ma. Expansion of the scheme. Okay. Next one is the aims and implementation. Aim financial protection to below poverty line population for medical treatment requiring hospitalization. Who are requiring treatment, who are requiring hospitalization. Okay. Implementation public private partnership mode. Okay. Arogyasri Healthcare Trust. Okay. So many services are offering. Argosy Healthcare Trust. Okay, what type of services? Argosy Healthcare Trust, insurance company, network hospital, district administration, health workers, software companies, regulator, risk coverage. So different way. Okay, they are using the services. Okay, cashless packages also available. Health camps, quality service, free diagnostic services, free food service, transport charges, free follow up medicine also. Okay, so disease coverage. Okay, disease coverage. Criteria of selection. These points you can write it, ma. Criteria for selection: emergency and life saving nature, requiring specialist doctors. Okay, surgical. This are all the conditions. 779 procedures. Okay, medical 159 procedures. Okay, so they will select the criteria. Okay, so this are all the 159 medical and surgical operations only. So by following this RGC scheme, so the some patients may get the benefit for the medical treatment. Some of the patients they may get the benefit for the surgical therapy. Okay, health card. Okay, some insured. BPL family covered means the group of individuals as indicated in the health card or white card ration card. Some insured for family income 1,50,000 benefit on floater basis can be availed by individual or family. Additional 50,000 in case of need from buffer amount. So this is a diagram of this one. Okay. Okay. Patient facilities and beneficiary choice. Arogya Mitra help desk. If you want any facilities, if you want any information, you may go through the Arogya Mitra. Then she may available in government hospitals. Help desk PHC government hospital. Assistance counters in network hospitals. 24-hour call center toll free line for this scheme. Okay, beneficiaries. Directly to network hospitals. Make a phone call. CMCO and referrals, attend health camp nearby, go to PHC Arogya Mitra 20%. Percentages they have given like this. Okay, same setup like this will be there. Okay, this one. Implementations Arogya Mitras. Okay, now doctors, insurance doctors, trust banks, citizens. Okay, registration, claim monitoring, claim processing, preliminary verification, diagnosis, administration, treatment, and everything. This is the network of the hospital by following this one. Okay. Okay, financial where they are getting the money. Argyasri, the funded by the tax revenues collected by the state of Andhra Pradesh and Telangana. Argyasri is a tool from the Chief Minister's Relief Fund. The scheme financial mode is cost effective. They prevent from fraudulent claims. The trust reviews the settlement history of each hospital at regular intervals. Okay. This is the infrastructure and manpower. How many members are working in a particular house, like working under the scheme of the Argyasri. Okay. So this is a process flow diagram. Health camp, primary health center, direct to hospital, chief minister office, 104 health service, 108 health services. Okay, this is a process of flow diagram. So like this, they may have the first contact with this one. This role they may have the contact with okay, they will contact with the network of hospitals. This is a different network of hospitals will be there, and again they may consider Arogya Mitra, Argyasri 2, Argyasri insurance company, insurance doctors, Argyasri healthcare trust, Argyasri healthcare trust panel doctors will group of members will be there. Panel doctors are I think the 6 to 8 members will be there. Okay, trust doctors they will trust the condition of the they after that they may approve, and after approving they may do the surgery. This is the flow of chart. Okay, health camps, primary health centers they may have the contact with the hospitals, network hospitals. They will consult the Argamitra. Okay, they may have contact with the health insurance company members. Okay, they may consult the panel doctors. In that panel doctors, only one doctor will trust, and after trusting, they may give the approbation, and after that, they will do the surgery. Okay, after surgery, they will discharge. Argyasri 1, Argyasri 2, CMCO, Chief Minister, Camp Office. Okay, insurance company, Argyasri Health, Revenue Department, and all. Okay, so this one. Okay, achievements. Targeting a specific health sector, involvement of private sector, wide coverage, quality medical infrastructure, expertise, follow-up services, cost effectiveness, effective monitoring mechanisms, impact on the performance of government hospitals. Okay, the merger of the Telangana government's Argosy Health Scheme and Center's Ayushman Bharat scheme was increased in the maximum health protection to 5 lakhs per year. Around 79 lakhs families who are beneficiaries of the Arogya scheme are eligible for it. Who are eligible, so they can also get the benefits by following this Ayushman Bharat scheme. Also, Ayushman Bharat scheme was increased the maximum health protection to 5 lakhs per year. Around 79 lakhs families. Okay, who were having RGC scheme, so those people are also eligible to get the benefits. It's clear. Okay, so till now I completed the questions with answers under the section 2 in the subject of the health center management for the MPHW secondary students in English version for English medium students. So thanks for watching my channel. Have a nice day.